are some common questions that are frequently posed to Dr. Sean Riley from Tulsa Spine and Rehab, and we like to address those questions from time to time here on the podcast. Dr. Riley, the latest question has to do with low back pain and surgery. You recently had a patient who was prescribed surgery, and they were looking for a second opinion. How did you deal with it?
Sure. This is a tricky one, and this is a guy that I saw this last week, and so this is a question that I get almost daily, and it's very difficult for me to answer. But we'll talk about this patient that I saw. May hopefully give you folks a little bit of information. It happens often that we have back pain and we've tried different things, or we haven't tried anything. We'll go to our physician, then he'll send us to a specialist, and the specialist will maybe do a few tests and say that they want to do surgery or operate. And when we hear that word, it gets our attention. Sometimes we don't know what to do. So with this gentleman, he was diagnosed with spinal stenosis, which is narrowing of the canal and of the holes where the nerves come out of. If I remember correctly, he didn't have any significant imaging findings where, it was anything emergent. This gentleman, I think he was 68 years old, and he'd suffered from low back pain just throughout the years, on and off. It really didn't limit his activity. It doesn't prevent him from doing anything. So I think that's what got his attention a little bit, that he hurts, and there's, pain was what took him to the doctor, but he was very surprised when the surgeon recommended surgery. Now, I've spoken to this in the past. I'm an advocate. I believe in surgeries when indicated. However, I think that obviously, surgery should be the last option if possible. And when I say should be the last option if possible, if you have a foot drop, or if you have weakness or bowel or bladder dysfunction, or, it just doesn't seem right, you're not able to get up and down, that is a whole nother situation. Like, there likely, aren't going to be any conservative options that we can pursue. And those are instances where you're going to want to get in and see someone and have it resolved quickly. Now, speaking about this gentleman that I saw, where he's had on and off low back pain for years, not a whole lot of history of radiating or radicular pain down in his lower extremities, just diffuse low back pain. My answer to him, and a lot of times I'll answer it the same way, and a lot of the surgeons I work with here in Tulsa will give them this answer, and this is what I really like. They'll say, Joe or whomever, you're going to know when you're going to need surgery. Meaning, okay, look, we have evaluated you, we've determined what your problem is, we've diagnosed it, and we've made a recommendation of surgical intervention, whether it's fusion or a discectomy or whatever it may be. But you have been, performing your activities of daily living. You're able to hang out with your wife and your grandkids and do what you want to do. You are going to know. And what that means is, like, it's going to get to the point one day when you just can't take it anymore. And that's when, you're going to have the surgery. But like I told him, I think there are a lot of, in his case, he hadn't tried anything. So I think he might have had some steroid injections in the past, but has not tried any chiropractic therapy or physical therapy, really wasn't exercising. Wasn't educated on self-management strategies or modifying his activities. So my answer to him was, I think there are a lot of different hoops that we can jump through before we get to that, the end of the line there, which is surgery. So I discussed it with him. There's obviously, with chiropractic and physical therapy, some of these other conservative options, there's limited risk associated with it, if none. So there's hardly any downside to it, with the exception of you're going to have to work a little bit and put some time into it. But I think the gain there is much greater than, at least giving it a shot than jumping straight into the surgery. Now, like I said, in some instances, there's not a choice. I mean, that's what's recommended, and that's what needs to happen. And by no means am I saying that we need to go against our surgeon's advice. I'm just saying maybe that we need to obviously figure out what our problem is, the severity of our problem, and look into all of our treatment options that are indicated.
Have you ever seen cases where surgery was prescribed but maybe wasn't necessary? Or let me ask it another way. Do you think sometimes surgery is the quick response when maybe not the most appropriate response?
Well, absolutely. And I think the more science and research that's coming out, and the way, our culture is educating ourselves on that, maybe it's not always what I need. And sometimes we look into the research that shows with some surgeries, we're having multiple surgeries after that first surgery to deal with other problems. Now, like I said, I'm an advocate and I believe in surgical intervention and surgeries when indicated, but, surgeons they're surgeons. They're trained to cut, and that's what they do. And they're very, there's a lot of guys here in Tulsa that are phenomenal surgeons. I mean, the majority of them are, but that's what they're trained to do. And so I am always refreshed when I, send a patient out for neurosurgical consult and the patient comes back and says, he didn't think I needed surgery at this time. I mean, that's refreshing because, that's the world they live in, obviously. And the world you live in, Scott, and the world I live in, this is kind of what we do day to day. And it's always refreshing when we can have a patient that goes to see a surgeon and says, listen, let's try X, Y, and Z before we do this. So, those are a lot of the guys that I work with here in Tulsa.
In this case, this gentleman was dealing with low back pain for years. You've probably heard that before. Why do you think people procrastinate in getting their back pain checked out? Is it, do people just assume it's part of aging or what?
Yes. And, sadly, males are much more capable of doing this than females because we're just stubborn. I mean, first we get busy. Our lifestyle doesn't allow us to get some help. We always think it's going to go away. And then you wake up like 7 years later and you're like, wow, I still have low back pain. And it used to be once a week. And now I'm experiencing it every single day. And even worse, I can't pick up my grandkids or go to play tennis or golf. Once I think it starts interfering and, the frequency increases, then we're like, okay, this thing's not going away. And my wife or my husband is tired of hearing me complain about it. And I think it's time that we, get someone to look at it. And I'm always a big fan of, if you've got low back pain or neck pain or something going on that persists longer than a week or two, it's always best just to get checked out. There's a lot of things, like I've said, that we can do initially for a visit or two that get patients returning back to what they want to do with no limitations that keeps them out of the office on down the road.
If you're experiencing back pain, have it checked out by the team at Tulsa Spine and Rehab. They'll give you an honest assessment of treatment options and make sure you understand your condition and what can be done. Give them a call today, 918-743-3737.